Mpox is not the new COVID. Regardless of whether it's Mpox Clade 1 behind the ongoing outbreak in East Central Africa or Mpox Clade 2 behind the 2022 outbreak that initially impacted Europe and has continued to circulate in Europe since. We know quite a lot about Clade 2 already. We still have to learn more about Clade 1. We can and must tackle Mpox together across regions and continents. So will we choose to put the systems in place to control and eliminate Mpox globally, or we will enter another cycle of panic and neglect? How we respond now and in the years to come will prove a critical test for Europe and the world.
Sawa sawa. Ndiyo. Tunaendelea tuko na ile dawa.
The need for a coordinated response is now greatest in the African region. The Africa Centers for Disease Control and Prevention declared an Mpox continental emergency shortly before WHO's global declaration. Europe must choose to act in solidarity. Solidarity with individuals and communities impacted by Mpox, by working directly with them to take charge of their own health.
We need to get the right information out to the people who are immediately at risk, as well as those who are likely to panic. Communicating with people about what they should do, what they should report, and how they should report so we can understand what's going on quicker and contain it better is critical. But long term, so that we don't have the same conversation again next year, the year after year, we need to ask ourselves, how do we define public health emergencies of international concern? When do we define them of international concern?
Hii majani yenye niko nayo mkono banaitaka kitamatama. Hii majani inatusaidia saa mtoto amepatwa na ile magonjwa, anakuwa na homa na ile hilupele.
Hii magonjwa, kuhusu hii magonjwa hivi upele vya kawambi, si walituambia aseme kama ni magonjwa gani. Hii majina miele jina ya ile magonjwa mimi sikumbuke, njome walisema ni kukula kama nyama ya pori. Jina leta hivi nani? Hivi upele, mimi sikule nyama ya pori au mtoto wangu aikule. Hapana. Tuliona tu vinajileta vile.
The first time Mpox was identified in countries was, in fact, in Central and West Africa in the 1970s. So 50 years on, there has been a shameful lack of investment to support researchers in African countries to really understand Mpox better. We still globally do not have a good understanding of Mpox, on the outbreaks, how it spreads, how many asymptomatic cases do we have for every case that we find with symptoms. We do not have a good understanding.
J'espère de tout cœur que la semaine prochaine, on va voir arriver déjà les vaccins. Donc, je peux vous donner à peu près le timing. J'espère que la semaine prochaine, on pourrait déjà voir arriver les vaccins. Vous savez, c'est vraiment toute une chaîne logistique qui va de notre acceptation d'abord et ensuite de quelques procédures administratives avant l'expédition, mais...
And today we're seeing about 100 new Mpox Clade 2 cases in the European region every single month. However, the current state of alert due to Clade 1 gives Europe the opportunity to refocus on Clade 2, a second chance, let's say, to strengthen Mpox surveillance and diagnostics, to issue public health advice, including to travelers, grounded in science, not in fear, not using stigma, and not through discrimination, to procure vaccines and antivirals for those who may need them, based on a strategic risk assessment.